Dr. Mark Vaughan of the Auburn Medical Group. Thanks for watching. I'd like to go over this death that occurred in Placer County last week. The patient had received the COVID-19 vaccine and hours later had died. The county has been putting out information on it. The news channels have been picking up. I see that even in the UK, people are starting to cover this story. And right now, all we know is that the patient had the vaccine, not through the county distribution of it, but through another party, and within hours of getting the vaccine had died. It's also known that back in December, 3 or 4 weeks earlier, the patient had actually had COVID-19. That's not a lot of information, and of course the concern is, could it have been the vaccine that caused his death since it occurred within hours? And absolutely it could be, and it may turn out that it was related to the vaccine. But we do need to look at this in a larger picture and a big perspective, and in no way at all minimize the loss that this family has experienced. And of course, our condolences to the family and friends. We want to show how we can help prevent this from happening to many, many, many more people, how one person does matter and it is significant. And I want to illustrate that with this figure here. First of all, we have one figure, and if we were to double this over and over and over, we would go through, say, 32, 64, 128, 256. It keeps going up, and it becomes rather quickly a large number where it's kind of hard to tell an individual. Here we are at 4,096. If we keep going, doubling, pretty soon we get to enough people that it would actually fill the Golden One Center. And then if we keep going, enough people to fill the Oakland Coliseum, even at a soccer game. And if we keep going, doubling every time, we get to a number a little bit more than the entire population of Sacramento. And if we keep going, we get to some pretty large numbers until we get to the population of the largest city in the United States, 8 million. And let's even double that, 16 million people. We've gone through doubling from one individual who matters and is important, and shown that rather quickly we can, with doubling, because of exponential increases in the numbers, we can get to a really, really large number where we just can't appreciate the individuals anymore. This is a sad thing that we can't. And then I want to show that this number we're talking about here is pretty close to the number of people who have already been vaccinated in the United States alone as of today, January 24th, when I'm recording this. That is so many people who have been vaccinated. And any story that we have of somebody being harmed with the vaccine matters, but I want you to see it in perspective with how many vaccines there have been. How many people, have been vaccinated. There's actually more than this because some people have already received their second vaccination. Some background on mortality rates. The mortality rate in 2018 was around 723.6 deaths per 100,000 people for the year. That comes out to about 100,000 people each month, ending up in 10 people dying, or 1 per 10,000 per month. If 18 million people have been vaccinated in the US over about the last month, that number of people, if you didn't vaccinate them, you'd expect there to be about 1,800 deaths. So when we hear about a death in the news related to the vaccine, know that you'd actually probably need to hear about 1,800 deaths rather than just one, if it weren't for having the vaccine. Just that's how many people die out of that many people, the number that were vaccinated. Worldwide, there have been 65 million vaccines given in 56 different countries. This is according to Bloomberg. 33 post-vaccine deaths in Norway and 7 in Germany. And these are being studied. Not all of them, though. Some of them, they didn't really take to be related to the vaccine and didn't study them as much as some others. Also, all of these people were over 75 in the Norway case. Some were on hospice. They were all described as being medically frail. And then the 7 in Germany had significant comorbidities like cancer. Now, this kind of information is not to minimize the importance of somebody dying from the vaccine, but to show us who do we need to especially look at and maybe think twice before giving them the vaccine. Okay, here's the perspective. You saw those huge numbers of people getting vaccinated not being harmed, with very, very few reportedly harmed or that we're investigating possibly being harmed by the vaccine. Now, 1 in 100 people die from COVID-19 infection in the United States. If you get it, you have a 1% chance of dying from it. In fact, we've already had a 0.1% mortality rate for the whole country, accounting both people who have had it and people who have not had it yet. That's a huge number. And I want to have that perspective that this vaccine is not perfect, but the thing that we're treating is very, very harmful, and particularly for people in vulnerable groups. Much more than 1 in 100 die when they get COVID-19. If they're over 80 years old or live in an assisted living facility, we need to very seriously look at considering getting the vaccine and not be swayed by the occasional report of some harm that could have come from the vaccine, may not have, but the benefits much outweigh the harm. Thanks again for watching. I hope this gives you some perspective regarding the vaccine and how it can help us and how it can provide a huge benefit for us. Until next time, Dr. Mark Vaughan telling you to stay in good health.